This week in our House Call segments, we have been focusing on smoking and lung cancer. This morning, Dr. Mohammed is here to talk about treatment. He is a medical oncologist and director of the Cone Health Cancer Center. Good morning.
Good morning.
We have talked a lot about how you find the disease and diagnose it. Today we're talking about treatment options, though, and that's something that that's the news a lot of people need to hear, right?
Yes, and let me just review some of the statistics about lung cancer. It's a major health problem. Over 1.3 million all over the world diagnosed with lung cancer. In the United States, 220,000 diagnosed in 2011, and here in North Carolina, 7,300 diagnosed with lung cancer in 2011. And unfortunately, we lost around 6,000 patients to lung cancer in 2011. It's a major issue, and actually we are behind some of the cancer, and that's why we like to raise the awareness for lung cancer. And November is the Lung Cancer Awareness Month.
Talk about some of the treatments there. We had talked about how it's difficult to detect early, more difficult than other types of cancer, but you still have options as far as treatment.
We have options for treatment. We like to diagnose lung cancer in early stage, because if we diagnose lung cancer in early stage, the cure rate goes so high. Unfortunately, 55 to 60% of the patients who diagnosed with lung cancer, they come in late stage. And that's the difficult part. Lung cancer a few years ago was a hospice cancer. Once the patient diagnosed with lung cancer in late stage, they send them to hospice. Now we have a lot of options to treat lung cancer. Let me just go back to the early stage. Surgery is the main treatment for early stage, but also we discovered that if we add some chemo to the surgery, that improves the survival. When it comes to the late stage, we have really reached the point that chemotherapy is now giving us a plateau. We are not moving any further by giving chemotherapy, so we start individualizing the treatment for patient. So every new patient now, we look for genetic abnormalities that can cause his cancer. Once we have a genetic abnormality, there are a lot of drugs that can work on these. Some of them already approved, a lot of other drugs are in the pipeline to treat lung cancer. So the future for lung cancer may come that the patient will come with his genetic profile and say, I have lung cancer and this is my genetic profile, and then we choose the drug based on that genetic profile.
You can have a better approach to the best way to treat that person.
Absolutely.
And you have kind of a different way of treating. You have, I understand, a team approach when you're dealing with each individual person.
Cone Health understands the importance of attacking lung cancer. Lung cancer is a very terrible disease, but we form a team because one physician cannot do it all. So we have a team from medical oncologists like me, radiation oncologist, surgeon, pulmonologist. The pathologist is in the room presenting the case, the interventional radiologist and radiologist. So we look at the team every week, every case that diagnosed with lung cancer at the Cone Health system. We discuss it every week to come with a treatment plan for the patient.
So you're literally re-examining cases each week. What does it give you to have those other voices in the room and those other people with expertise?
This group of people are really interesting to change the outcome of lung cancer. And because the lung cancer is a very fatal disease that really the mortality is so high compared to other cancer. So we found that the best way to attack this is to attack it as a team, not just an individual person. And we don't like to delay treatment. We like to start treatment quickly so the patient can benefit from the treatment rather than moving from one office to the other with delay in the diagnosis and treatment.
Doctor, thank you very much.
Thank you so much.
We appreciate you talking to us about it, and we appreciate you bringing the expertise this week.
Thank you.